Hey everyone, and welcome to Crafting with Courtney at W.N.T.E. This is Courtney at Commonwealth University Mansfield. So let's be honest, when most people hear video games, they usually think of addiction or isolation, probably also wasting time. And yeah, sometimes it does happen. But what we don't talk about enough is that video games are also helping people deal with anxiety, depression, and even PTSD. So today, I want to discuss that video games aren't automatically bad for mental health, and when they're used the right way, they can actually help. So, anxiety can feel like your brain never shuts up. Constant overthinking, there's stress and worry, but video games give people something anxiety doesn't: structure, control. And when you're focused on a game, you're not replaying every bad thought in your head. You're concentrating, reacting, you're solving problems. Psychologists call this a flow state. So basically, being like in the zone. So, one risk is using games to avoid real life, but we can manage this risk by setting time limits and using games as a coping tool, not just a hiding place. That lets people calm their minds without ignoring their responsibilities. Depression makes everything feel harder than it should. Even simple things feel overwhelming. But video games help by giving players small, achievable wins. You finish a level, you solve a puzzle, you're accomplishing something, even when your brain is telling you that you can't. And some games are even designed to teach coping skills that therapists use, like spotting negative thoughts or problem solving, but without the pressure of like a formal therapy setting. The main risk here is playing too much and isolating yourself. But that's not a reason to throw games out completely. When gaming is balanced with schoolwork, social life, it can support mental health instead of hurting it. Video games, especially with virtual reality these days, they're also being used to help treat PTSD. So, PTSD often gets worse when people avoid anything that reminds them of trauma. But with virtual reality, therapists, it lets patients face those memories gradually, safely, and with a therapist guiding that experience. Sure, revisiting trauma sounds scary, and it definitely can be, but that's why it works best with professional supervision, where the experience can be paused or adjusted at any moment. If used it correctly, it helps people regain control instead of feeling trapped by the past. Video games also teach resilience. When you mess up, you try again, you improve, and that mindset carries over into real life. Online games can help people feel less alone, especially when face-to-face interactions feels incredibly overwhelming. Are there risks? Absolutely. Too much screen time, ignoring responsibilities, unhealthy habits, they are all real concerns. But those risks don't mean that video games have no value. They mean that video games need boundaries. So, video games aren't a replacement for therapy or medication, but they're also not the villain they're often made out to be. When used intentionally, in moderation, and with clear limits, video games can reduce anxiety, lift depression, and even help people work through their traumas. So instead of asking, are video games bad for mental health? Maybe we should be asking, how can we use them better? Because sometimes helping your mental health doesn't start somewhere unexpected, like picking up a controller.